I'm going to go ahead and get started with the presentation that I have presented for you guys. So today I really just want to introduce you guys to the dental school interview and give you guys some tips and tricks and some thoughts on how you can tackle the dental school interview effectively and well, and in a way that presents yourself well, and honestly, and in a way that maximizes your chances of getting an acceptance into dental school. Um, this presentation today is definitely not meant to be comprehensive and your only tool for preparing for your dental school interview, but it's a step. It's step one. And I hope that I can get you guys excited to be thinking about how you want to prepare for your interview. And I hope that this presentation gives you guys kind of like a little bit of a introduction on how to jump into tackling the dental school interview. That's awesome, Jake. I hope that this presentation can help you with your interview prep for your interview there. Real quick, a little bit about me. My name is Tion. I am about to be a second year dental student at Rutgers School of Dental Medicine here in New Jersey. I did my undergraduate at Emory University where I studied chemistry. In my free time, I love playing tennis, playing golf. I also spent a lot of time at my local church serving and mentoring high school and middle school students. And this was just a trip to Banff a couple summers ago with some of my college friends. Great time. If you guys ever have a chance to visit Banff, I highly, highly recommend it. Um, yeah. And here's a little bit about me and my application story to dental school. When I was applying to dental school, I applied to 10 total schools. Out of those 10 schools, I was able to secure 5 interviews. And through those 5 interviews, I was able to secure 2 acceptances. Now, that's after kind of withdrawing my application to some of the schools that I knew I wouldn't be interested in after putting a deposit down at Rutgers. So just keep that in mind. Also, I am definitely not a pro at interviews. I'm definitely not like a professional by any means. I have my experiences and I have some experiences that I've been able to kind of build up throughout the years with the people that I've talked to and the resources that I've read and that I've understood, and some really great resources that Bootcamp has offered me to present with you guys. But I'm definitely not an expert, and I'm going to try to do my very best to be very honest and upfront about what I have more experiences in and what I don't really have a ton of experiences in. Like I said, this presentation is really just to get you guys to start thinking about your interviews and kind of a first stepping stone into preparing for your interviews. And definitely, this presentation is not by any means supposed to be fully comprehensive for your entire interview prep. So I'm going to do my very best to be honest with you guys and just try to help you guys in any way that I can. So, what is an interview? An interview is, and really most of your dental school application process is an attempt to show who you are to the admissions committee, to both honestly show who you are and to convince them that the characteristics and traits that you have and the assets that you bring lead you to be a very, very good candidate for dental school who can succeed through the dental school training and become a very competent and professional and amazing dentist later on in life. So similarly to your personal statement and your really the rest of your application, in an interview, your main goal is to show who you are and show why you want to do dentistry and show why you would be a really good candidate for dental school. Your goal during the interview is definitely to help the faculty member feel confident that you are a good fit at their specific school. This is super important. In my personal experience at Rutgers, after I interviewed, I learned that the admissions committee actually met right after that whole day's interviews and discussed all the candidates and made decisions on whether or not to offer acceptances to those candidates immediately on that day. So, in that instance at Rutgers, for me, it was really important that I really convinced the faculty member I was interviewing with that I would be a good fit at their school, because then that faculty member is going to advocate for me when the whole admissions committee met together to talk about all the candidates of that day. Um, Yeah, Jake, I think that's definitely enough time to prepare for in 2.5 weeks. I think you're gonna have to spend a considerable chunk of time preparing, but I think that is definitely plenty of time. I'm gonna offer some thoughts throughout this presentation on what to kind of brainstorm, what to think about, and I really recommend practicing and rehearsing your answers, as well as maybe doing a mock interview with possibly a friend or someone who might have some more experience with dental school interviews than yourself. So let's go through a couple different types of interviews you might see through your dental school admissions process. Any interview could be open file, where the faculty member interviewing you has complete access to your file. It could be closed file or semi closed file. Those are pretty self explanatory. You could have a traditional interview, a one-on-one interview. That those were most of my interviews. Most of my interviews were one-on-one traditional interviews, whether that be on Zoom at the time or in person. You could also have a panel interview where you have two or more interviewers interviewing you as a candidate. You can also have a something called multiple mini interviews, MMIs. They're commonly abbreviated to, which are multiple stations with a different question at each station. I'm gonna do my very best to offer some insights about this interview style. However, me personally, I didn't have any of these throughout my dental school application process. So this is definitely one of the areas where I might have slightly more limited knowledge. You also might have group interviews where you have interviewers asking questions openly in front of a group. So I had a personal experience with this at LECOM down in Bradenton, Florida, where about like five, six, seven of us were being interviewed by two faculty members in like a very small classroom. You could also have an online or video interview. These are a little less common now. They were a lot more common during COVID back in the day. So, how do you start preparing? First, you got to brainstorm. You got to start thinking and preparing and being prepared to have some main points you really want to hit on during your interview, and some main points you would really want to hit on depending on what specific questions you are asked during your interview. Some things to consider include kind of formulating and brainstorming and writing an interview question bank and answering those questions as like writing some answers or some bullet points for those specific questions in that question bank. It's also definitely important to think about what the interview is looking for. Some of those things might be clinical skills, didactic studying skills, interpersonal skills, interacting with patients, ethics questions. So something to think about is kind of breaking down an interview question and think about, okay, so this question is worded this way. How should I answer this question to really help the interviewer have a well-rounded answer to the main point that they're trying to look for in me, the main characteristic they're trying to look for and find in me. It's also important to plan your responses. I am a big advocate against writing a response and memorizing a response. I think that kind of doesn't really feel super real to me as an interviewee, and in my experiences interviewing people for other things. I don't really like having a fully planned written memorized response, but I do think planning your responses, especially having some main idea bullet points, is extremely important as you're preparing for your interview. Um, Always great to ask for feedback, rehearse your responses so you sound natural and confident. Remember, like I said, I don't really like a fully memorized response, but even with bullet points, it's important to rehearse your response to make sure what you're communicating and what you're saying is coherent. And mock interview experience, that's always great because nothing really substitutes in like mock interview experience, kind of having question after question, kind of really practicing thinking in a effective and efficient way where you're not leaving super long uncomfortable pauses in the interview. I see a question in the, let me check the chat. Yeah, absolutely, Jake. I think not sounding rehearsed and scripted, ironically, I think requires more time rehearsing sounding normal. I don't know if that made sense, but I'm a big advocate for kind of having some bullet points and some main ideas you want to hit on during your interview response, and then maybe using those bullet points to rehearse a response that covers those bullet points without reading or memorizing word for word your response. That way, each time your response is slightly different and is natural and flows, but it's not the same thing every time, so it won't really sound rehearsed. For me personally, that has worked pretty well for me. Let me know if that's helpful. If it's not, feel free to throw another specific question in the chat about that. So a very common dental school question that gets asked is, why our school? There's not a ton of dental schools in the country, but there's enough where dental schools really want students that are passionate about their particular school and that want to get into their particular school, because those students are more likely to be more than just dental students at their school. They're more likely to get involved in extracurriculars. They're more likely to go on kind of extracurricular trips with the school and just be more involved and take that extra step. It's also important to kind of know the specifics and particulars about the school to demonstrate that enthusiastic interest in the school. For example, some schools might have um, particular ways that they do clinical experience. Some schools might have very specific ways that they tackle D3 and D4 education and how D3 and D4 students are able to see patients in the clinic. Some schools might have specifics in academic curriculum. Some schools really focus on community service, and that could be something really helpful to know in advance so that you can comment on during your interview. Research opportunities also vary depending on the school, and showing interest in some specific research that's unique to that school can really demonstrate specific interest into that particular school. Something cool that I actually learned from Bootcamp is to follow the rule of threes. Kind of giving three major reasons is a good way to balance being concise while also making sure your response is significant and memorable and actually shares and reflects you as a person and as an applicant. So here's like a generic example response to the question, why our school? This is not my response by any means. If I'm being fully transparent, I did not get an interview at the University of Pennsylvania. They just denied me, which is 100% okay. But a student interviewing at the University of Pennsylvania might comment on how they are very interested in that school because of a strong emphasis on clinical experience, because as D1, D2 students, they get to start assisting D3 and D4 students in the clinic. Starting D2, they get to start seeing their own patients. And even as early as D1, they get to do some specialty rotations to really get exposed to what specialty programs in dentistry are like. A student interviewing at the University of Pennsylvania might want to comment on their didactic curriculum. They use a system-based approach where they kind of learn each system on their own in various different subjects throughout their didactic education. They also might want to comment on some specifics about community service. For example, hearing from current students about the Life Center and the Philadelphia Fight program could be, the Philadelphia Fight could be really, really awesome in showing that interest, that specific interest in that particular school. Another question that you commonly might see is, tell me about your shadowing experience. Now, a easy kind of trap to fall into with this question is to just start summarizing your shadowing experience. A general good rule of thumb throughout your whole interview process is you really want to avoid giving answers that the faculty member can learn very easily and very well from your application. You've already submitted your application, you've already written your personal statement, you've already done your experiences section in your application, and all that information is already available to the admissions committee to review. So during your interview, you're really trying to offer new insights into yourself as an applicant and yourself as a person. So when you talk about your shadowing experience, I think it's important to offer new insights. And new insights could be some specific things that you got out of your shadowing experience, some insights you got out of your shadowing experience, some things you noticed that you really want to emulate when you're going to be a practicing dentist, or even when you're a student dentist at the school itself. Shadowing experience is typically an integral part of your decision to pursue dentistry. I think that's why they like to ask that question. Some ways to think about how you would want to respond to this question include, like, what did you learn and what did you enjoy about shadowing? Maybe kind of commenting on certain procedures that you found very fascinating, certain tools and equipment, certain ways that the general dentist or the specialist that you shadowed used manual dexterity that was really cool that you wanted to emulate, and especially patient interactions, how the dentist interacted with certain patients, is definitely something really cool to comment about, and also to state that you want to emulate that as you begin practicing dentistry. So an example response for like shadowing could be as follows. So this is actually a personal response of mine. This is how I would really answer this question if I were asked this in an interview. But one of my shadowing experiences was with an endodontist. I shadowed this endodontist pretty extensively, and I got to know him really well, along with his staff and how he ran the practice and how he saw patients. And through shadowing, I saw some really great relationships between this endodontist and his staff. He demonstrated really great leadership that I want to emulate one day. Leadership that kind of brought like a calm to the whole practice, because he was kind of in charge, not in like a mean like drill sergeant kind of way, but just in a very calm, mature, professional leadership way. I noticed that this endodontist was extremely thoughtful with his staff, kind of very considerate and aware that like his staff has a lot going on, and he's very thoughtful with all of his interactions with his staff. Friendliness kind of falls with that. And all of these traits together led to his relationship with his staff being very effective and efficient, and allowing his practice to work and function and flow very effectively and efficiently. I also noticed some very specific things about his relationship with his patients. One of the really cool things I noticed was an empty waiting room. His waiting room was pretty much always empty, and that was intentional. I noticed that patients coming in would rarely spend more than 2 to 4 minutes in the waiting room before being seated in an operatory. He also demonstrated a ton of patience with his patients, kind of a tongue twister there, but he demonstrated a lot of patience with his patients as he was explaining certain concepts and how certain procedures were gonna work. And just his communication with patients was really outstanding, and something I want to emulate when I'm a student doctor and when I'm a dentist, fully practicing, because I can offer the treatment, but if I'm not communicating the post-op or the dental hygiene habits well, then my treatment is really just temporary, and the patient is still going to suffer with problems moving forward because of improper routine maintenance. Another question you might be asked is, why dentistry? So dental schools really want students that are extremely interested in dentistry, because dental school is hard. And if you don't have that interest in dentistry, and you don't have the right reasons to pursue dentistry, the chances of you maybe not making it through dental school become higher. So they really want students that have a really strong interest in dentistry. So a good way to answer this question is to use anecdotes. I think anecdotes are really cool, and they offer a lot of insight into you as a person. And it can be a great way to kind of show why you're interested in dentistry, why, rather than just saying you're interested in dentistry. Like I've said earlier in the presentation, I think it's important to avoid being repetitive, especially what you've already mentioned in your personal statement. You really want to offer new insights through your interview, because if you kind of are repetitive with your personal statement, then you're not really giving yourself more of an advantage through the interview process. Another question, a tougher question, is what are your weaknesses? I think this is a tough question, because it's very important when you're being asked this question to find a balance between being honest, but also not focusing too much on the negatives. It's important to be honest with your weaknesses, because everybody has weaknesses, and kind of show a desire to improve in your weaknesses, but you really want to avoid dwelling too long on the negatives of your weaknesses. Um, I think a good way to do it is kind of just very straightforward: state your weakness. And then, with a lot of passion and a lot of honesty and speaking from your heart, talk about how you want to improve from that weakness. And then end on a positive note, if you can, in your response. So this is another example of response that I personally used in one of my interviews. But when I was asked one of my weaknesses, I really feel like staying up to date with news, really any sort of news, but specifically in the dentistry context, dental news, and new dental technologies that are being used and that are available in the field. Um, so I stated that I wasn't the best at that, and I wasn't the best at staying up to date with that. And then I kind of shifted to why this is a weakness and why I need to improve in this, by talking about how I see the value behind being more knowledgeable about these things. Kind of just overall awareness of the events around me in the world is extremely important. Awareness of new dental technologies and techniques are important for me as a dentist, as a practicing dentist. Very important for me to stay up to date with dental technologies, because something might come out that helps me treat my patients better. And it's very important that I'm aware of that so that I can implement that in my practice. Um, and just like stating how I am going to make an effort to improve. And I'm going to do that by kind of reading more research articles and reading more about current events and about dental techniques that are currently being implemented. So, multiple mini interviews. This is actually something I don't have a ton of experience in, so I'm going to try to share as much as I can and be as helpful as I can. But definitely, if you have some MMIs coming up, I definitely recommend you looking for some um, some other resources to kind of supplement your knowledge. But during MMIs, you might see a very broad range of questions. With practice, you'll get better at answering these kind of questions. And the way that they kind of work is you're given a prompt, which might be like a paragraph, and you're given a minute to kind of read it and formulate your response and kind of prepare. Then you would walk into a room, say hello, be respectful, professional, shake hands, and a really great idea is to start your interactions in the room by saying, let me recap the scenario to ensure I understand it correctly. That just really makes sure that you and the interviewer are on the same page, and then you can jump into your response with the confidence that you're answering the question the correct way. You're understanding and interpreting the question well. So here's an example MMI question. Clostridium difficile is a type of bacteria that increases its activity with most antibiotic use and is therefore very difficult to treat. Research shows that the most effective way to prevent the spread of infection is frequent hand washing. However, many people have flat out refused to wash their hands in hospitals. The government is contemplating passing a policy to make it mandatory for people entering hospitals to wash their hands, or else risk not being seen by doctors and being escorted out of the building against their will. Do you think the government should go ahead with this plan? Consider and discuss the legal, ethical, or practical problems that exist for each option, and conclude with a persuasive argument supporting your decision. So you'd be getting this question, and then you'd be kind of thinking about your answer, and then you would go into the room with a response. So here are some main points that I would hit on, or some main points that you should hit on if you were given a question like this. So this scenario that was given has many aspects. Remember, with these kind of questions, there isn't one specific answer. Obviously, we would want to provide care and not just refuse people because they didn't wash their hands. The first thing that comes to my mind is to offer a different method, such as hand sanitizer. However, hand sanitizer is actually ineffective against C. difficile. Although you aren't expected to know this, but they will probably follow up with this fact. Next, I would suggest a quarantine on those patients who are prone to this bacteria, which is actually what they do at hospitals. It would be unethical to put these patients in an environment to make them more sick. Something along these lines with a more in-depth explanation would be a good answer. So this is kind of just an idea on how you might want to tackle a question like this in an MMI. Let me take a quick look at the chat. I think it depends on the question that you're asked, Jake. So some questions might be prompting you to speak in the first person. I think those questions usually start with like kind of pretend or speak as if you were a dentist or something like that. However, if it doesn't explicitly kind of cue you in to talk in the first person, I think it can be a conversation with the interviewer, kind of going through some main points and main ideas that you would hit on, and kind of like, yeah, just sharing about the scenario with the interviewer. So, as I begin to wrap up, some things to keep in mind. Ethics is extremely important, and it's something you might want to consider in almost all of your responses to any scenario based question during dental school interviews. So, some basics on ethics, some key terms. Autonomy refers to respect for patient autonomy refers to respecting the patient's decision and their capacity to make their own decisions. Pretty much, patients get to make their own decisions, and they get to choose for themselves what they want for their health, um, and for their own well-being. Beneficence is a concept of acting in the patient's best interest as a healthcare provider. So it would be pretty much just remembering that whatever I am doing, I want to do good for my patient. I want to help my patient as much as I can. Now, maleficence is a slightly different than beneficence, where it actually refers to do no harm. It specifically refers to avoiding anything that will cause your patient undue, unresponsible harm. And where everything we're doing, we're supposed to help our patient and not cause any more harm. So an example of like kind of unintentionally doing harm would be kind of like a procedure where you might be doing a filling and going too deep and not rupturing, going too deep and perforating the root of the tooth. That would kind of be doing a little bit of harm that wasn't necessary for the procedure. Now there are some times where a cavity is so deep that like that becomes unavoidable, and obviously that is always a risk. But as dental providers, we want to do our very best to minimize those risks and prioritize not harming our patients, or in other words, non-maleficence. Refers to kind of the availability of resources and allocating care and resources to patients. So kind of like all patients getting treated fairly and treated justly. Informed consent is very important. This kind of goes along with autonomy a little bit because it refers to the ability of an individual to make decisions, and it refers to the fact that individuals have autonomy and they must express consent before a healthcare provider can provide any treatment. Confidentiality is really important. Something, if you guys have worked in healthcare a little, you hear about HIPAA. That is very important in confidentiality, and it refers to a healthcare professional's um, duty to respect their patient's privacy and keep their medical records confidential. An emancipated minor is an individual younger than 18 but treated as an adult and has the ability to make their own decisions. Has the ability, or in other words, has the ability to act autonomously. They must meet certain criteria, and those criteria and laws vary depending on the state that you're in. All right, real quick, some closing thoughts. I'm gonna take a look at the chat real quick. 5 important questions. The questions that I covered in this presentation, I believe, are very, very common questions that you will see in your dental school interview. I think interviews like interviewers sometimes like to start with the question, tell me about yourself. So I think having a preparation for that is important. Definitely preparing a response for why our specific school is very, very important. And then really just the other questions that we kind of went over in this presentation, I think are ones that you would really want to prepare for. Something else that could be helpful is you can kind of go online and search on like Student Doctor Network or like those kind of websites to see what are some common questions that certain schools ask. Now, when I was applying for dental schools and interviewing, those weren't always super accurate because different faculty members will ask different questions, but it could be a good idea to kind of just look at that to have a starting point on what questions might be asked. We were just talking about this. Oh, actually, never mind. I'm sorry. I got a little confused with another one of my slides. But prepare questions. So at the end of the interview, the interviewer will 99% of the time ask you, do you have any questions for me? And it's very important to ask questions here um, for two main reasons, in my opinion. One, to just demonstrate interest in their school, and two, just becoming more memorable, having questions and having some discussions that are going off of what you had planned and what you are kind of driving makes you a little more memorable than kind of just letting the interviewer drive all of the conversation. um yeah, when you're asking questions, try to avoid asking negative questions. If you have any like clarification questions that came up um throughout the interview, feel free to ask them at the end during this time, and try to think about questions that encourages more dialogue and conversation with the interviewer. um So professionalism is extremely important. A couple tips about that. Whenever schools are communicating with you, try to be really on top of your email throughout this whole process. So whenever schools are communicating with you, try to get back to them within a day. So if you get an interview invite, try to respond within a day. If any communications that require a response, try to get back within a day. You might get, like, as you're getting closer to your interview, you might get an email about confirming your attendance at the interview. Again, try to respond within a day. Interview attire, it's important. It's extremely important to dress professionally as well. And for guys, that's going to look like a suit and a tie. And for girls, that might look like a blazer or a suit kind of thing. Just very business professional for sure. What's good? Questions to ask. I think questions to ask will vary by school. I think asking questions that are specific to that particular school is a great way to demonstrate strong interest in that particular school rather than just asking a generic question that could be asked to any school. So asking about kind of clinical experiences and how the school tackles that could be a really cool question to bring up discussion. Asking about research opportunities, and then doing some research about the school and asking about maybe some specific research opportunities or some specific externship or clinic opportunities that that school offers could be a really good idea for your interviews. The night before your interview, so I was a bit naive and I didn't think about this, but luckily someone mentioned it, and I remembered. Um, if you're traveling for your interview, when you get to the hotel, lay your interview outfit out and hang it up in the closet before bed at the hotel. That'll help kind of the fabric kind of rest a little and any of the wrinkles to um, kind of flatten out a tiny bit. Have a breakfast plan. I think it's important, extremely important to eat breakfast to have a clear mind and have the energy to tackle an interview day. Plan well for travel time. Plan your Ubers well. It could be a good idea to schedule your Uber in advance if you need to. And definitely get to your interview early, but also like get to your hotel at a reasonable time the night before so that you can sleep well. Having good rest is extremely important to performing well at your interview the next day. So, interview day, try to arrive about 15 to 20 minutes early. I would even say maybe 30, 35 minutes early, just as you're planning, just to make sure, again, your Ubers are all squared away and you get there with plenty of time. When you get there, if you're feeling a little nervous, feel free to do a quick walk up and down the block. A lot of my interviews were in like September, and I had like some late August, I had some in September, so I wasn't really about to go walking up and down the block, especially at my interview at Lecom down in Bradenton, Florida. It was a bit hot, but I did take some time to really just calm down. I went to the bathroom just to calm down, make sure I don't have to use the bathroom during any of the presentations and all of that. Try not to go too early. just to make sure that kind of they have time to prepare and be ready for you. Smile, be happy, be ready, be excited. Um, and really just I don't think you're gonna be watched at all times, but have that expectation, be ready, know that your interview is that whole day, and be ready to make a good impression with whoever you meet along the way. Having great manners and professionalism is extremely important throughout the whole day, again, with everyone that you meet. And like I said, remember, your interview starts when you walk on campus and doesn't end until you leave, so have that um, good mannerism and good professionalism and great attitude throughout the whole day. Mindset, that's a great question, Jake. You're hitting me with a lot of great questions. I think just an enthusiastic mindset is best. Kind of having the excitement to learn more about the dental school you're about to interview at, and the excitement to be able to share about yourself and share why you would be a really good candidate is kind of the mindset that I would have going into an interview. Um, I think being excited, being happy, being joyful radiates, and people can pick up on that. So I think that's a good mindset to have as well, because I don't think having kind of like a sad mindset or a negative attitude um, would be beneficial in any way. But having a joyful, respectful, professional, excited mindset and attitude, I think actually goes a long way. And I think is extremely evident when the interviewer sees you and hears your responses. Something to consider are thank you letters after your interview. Feel free, you can send emails, thank you cards in the note. Try to make sure that you thank them for the interview. You could have some brief points about what you liked about their particular program. Briefly reiterate your interest. Keep it short. Keep it one paragraph. I think even shorter than one paragraph is great. These faculty members are very, very busy, and short and sweet is definitely better for these kinds of communications than kind of rambly and long. And include your name and access ID just so they know who you are. And I just wanted to shout out real quick the DAT Bootcamp application services. Like I said, I am not a professional about interviews and the dental school application process. I have my experiences and the experiences that I've picked up along the way. But DAT Bootcamp application services, they are pros and they are ready to help you with your application along any stage, whether you're working on your personal statement, whether you're working on secondary applications, whether you're thinking about interviews and working on interviews and really trying to maximize the impression that you make when you go on your interview. I'm going to put the link to DAT Bootcamp application services in the chat. Please check them out. They have a bunch of different options on how they can help you and ways that you can speak with them and use their services. This is just another list of the variety of things that DT Bootcamp application services can do for you. Personal statement, experiences section in your application, secondary applications to schools, interview coaching are all things that DT Bootcamp application services can really help you shine extra bright in. And that's pretty much all I have for you guys. Thank you guys for being a really, really tremendous audience. I hope that this was helpful to you guys in at least a little bit. That's definitely my goal here, just to help you guys as much as I can. When I was going through the dental school application process, I got a ton of help from students who were a little bit ahead of me in the process, and I don't think I would have been able to do it without that help and that insight. So I just wanted to provide that for you guys today. I really hope that this was helpful. And feel free to note down my email and email me any questions you guys have. And now, any extra time we have, feel free to hit me with questions. I know there's a little bit of a delay with the live stream, so I'll give it like 30 seconds to a minute. And if I don't get any questions, I will end the live. But yeah, if you guys have any questions, please feel free to throw them in the chat now. And I'm going to keep this screen on just so you guys can note down my email if you want to. And really feel free to email me at any time with any questions, and I'll try to get back to you guys as soon as possible. That's a great question, Jake. That's hard, right? Like you definitely don't want to over prepare. I think having some main ideas and main bullet points. That's I think the best way to prepare for dental school interviews, having main ideas and main bullet points you want to hit on across your entire interview and for some of the specific questions. I think kind of writing like word for word responses is not as effective, and then taking those bullet points and practicing responses that aren't verbatim word for word is a great way to prepare and to prepare in a way where you're not over preparing. Something that I heard that was very helpful for me when interviewing is, yes, obviously the interviewer is guiding the question, but also don't hesitate to kind of guide the question yourself as well. You can take your response to one question and kind of pivot into something else that you wanted to talk about, as long as it's relevant. Obviously, don't just kind of completely change the topic, but you have a certain level of control throughout the interview as well. It's not fully just guided by the interviewer. And yeah, I think just preparing some main bullet points you want to hit on throughout your whole interview, and some main bullet points you want to hit on for each individual question that you're preparing for is plenty. Um, but yeah, I think if you're asking this question, that means you are taking this seriously, and that's the most important thing, to take this seriously and to spend time preparing. Um, but yeah, I hope that was at least somewhat helpful. Does anybody have any other questions?